As now is the Health Secretary Matt Hancock. Mr. Hancock, always a pleasure to see you. Thanks for joining us this morning. If it's such a big problem, why not introduce it today?
Well, we need to take this action. We've seen the rise in the number of cases, and we also want to set out very clearly for everybody so that everybody has the chance to see these rules, read them, and then to follow them. And that's why it'll come into force on Monday. I mean, as you've seen, Kay, where there's a big spike, like in Bolton, we take action immediately. But the reason is that these rules are so important. Every single person in the country needs to know what they are so that we can together keep a grip on the virus, and therefore we'll be publishing the details of that so that everyone has the chance to read them, to really understand them, with the total clarity that we've brought with saying that 6 people, you can't have gatherings of more than 6 people, except in some very limited exceptions outside of work and, of course, school.
The Northern Ireland Secretary yesterday told us that the government was prepared to break international law in a very limited and specific way. Why should we abide by the rules?
Well, of course, abiding by these rules is absolutely vital to protect life. You know, we've seen the increase in the number of cases, sadly, in the last few days. We've seen that across Europe there's a second wave that many countries have experienced. Some of those countries have then got that second wave under control. If you look at what's happened in Belgium, they saw an increase and then they brought it down, whereas in France and Spain that just hasn't happened. And we're determined to take the action that keeps people safe.
And to my point, the government is prepared to break the rules when it suits you, so why should we abide by them?
Well, look, on the question of the Northern Ireland Protocol, the government has a number of international obligations, and the primary amongst those in this context is protecting the peace process. That's about people's safety and security too. In this case, in the case of coronavirus, everybody understands how important it is that we together keep this under control. We can't do it individually because of the nature of the disease. It passes on. So yes, it is incredibly important that everybody follows these new rules, and we'll be bringing in strict enforcement so that they can be followed.
Sarah Vine, front page of the Mail this morning, I'm sure you've seen. However nervous we are, we must find the courage to get on with our lives. She's the wife of the Chancellor of the Duchy of Lancaster. That's not really helping, is it?
Well, Kay, I think you'd be the first to say that it doesn't matter who you're married to. You know, people can have different opinions. So I haven't seen that, actually, but I know Sarah very well, and she is she's wonderful and highly opinionated.
I'm twice divorced, so it doesn't really apply to me as far as I'm concerned, Health Secretary, but nevertheless, she is going against government policy. Is she wrong?
We've absolutely brought these changes in for a very good reason, and the reason is that, as you can see in other countries, if you have a rise in the number of cases and you don't act, then that inexorably leads to more people in hospital and more people dying of coronavirus. And I've been talking obviously with Michael Gove and others on this. Michael is a very strong supporter of the action that we're taking today, and the reason is really clear. It's that we need to get through this coronavirus with the minimal impact on people's education, as minimal impact as possible on work as well. That's why we're exempting education and work from these new rules. But it does mean that when it comes to socialising, we are unfortunately having to put in place rules, because our contact tracing system, which is now excellent, shows that the majority of this transmission of this disease is actually in social circumstances.
OK. You encouraged, as a government, young people to eat out, to help out. In fact, all of us during August. You have encouraged us to return to work. You've encouraged young people to go back to school. You've encouraged older young people to go back to university. And now they are being blamed for a rise in cases. They are feeling disgruntled this morning. It's not really surprising, is it?
We've absolutely described where the rise in cases is, because I'm certain that the best way to tackle this is with as full transparency as possible about where the cases are. And so, yes, we've described that. All the things you mentioned is about bringing back the things that, as much as possible, whilst keeping people safe. It's a tricky balance, but I think people appreciate what we're trying to do. Protect education, very, very important. Protect work, because people's livelihoods are vital too, yet also keep the virus under control. That's the strategy. And the way we do it is first and foremost with social distancing. And what we're announcing today is we are having to tighten those rules for social distancing in a social context, in the socialising that people do.
One of the members of Independence says the way that you do it is improve the testing and tracing system. He's described it this morning on our programme as failing. It certainly isn't fit for purpose at this stage. We spoke last week and you said you're investing hundreds of millions of pounds more in order to improve it. Still, we saw a story just on Twitter yesterday, 215-mile round trip to Leicester is the closest place for a gentleman who needs a COVID test because he lives with his elderly parents. Many other people, one of my producers this morning checked on the website, he can't actually get a test because it says the service is currently very busy. It's failing. You have to accept that at this stage, the test and trace is failing. And as far as testing for COVID is concerned, what do young people do if they need to have that test, if they want to be responsible, as you say?
I completely reject that, the fact that it's that accusation. In fact, quite the contrary. And if I just set out why, firstly, we have the biggest testing system per head of population of all the major countries in Europe, and we've built it essentially from scratch. Right now, we have the highest capacity for testing that we've ever had. It's increased compared to last week. And that testing means that we can find these cases and therefore help to keep the virus under control with the contact tracing system as well. However, in the last couple of weeks, we have seen an increase in demand, including an increase in demand from people who are not eligible for tests, people who don't have symptoms. You are eligible for a test if you have symptoms of coronavirus or if you have a very specific reason otherwise. And I've been looking into this, including since we talked about it last week, and we have seen an increase, and about 25% of people who are coming forward don't have symptoms and aren't eligible, don't have a reason for it. So we are having to, at the moment the system is really very straightforward because we want it to be easy for people with symptoms to get a test. But the message is also clear that if you're not eligible for a test, if you don't have symptoms or you haven't been asked to get a test specifically by a clinician or by a local authority, then you shouldn't be coming forward to get a test because it makes it harder for people who really need them to get those tests.
Plenty of people are asymptomatic. How do they know if they've got COVID if they're asymptomatic unless they have a test?
Well, where, for instance, in care homes, people are in high-risk settings, we brought in that asymptomatic testing, exactly as you describe, and those people are eligible because they have been told to get a test. But if you're otherwise asymptomatic, like you or me, then there is no reason to get a test. We've had stories of, schools sending a whole year group to go and get a test, and that is not appropriate. What is appropriate is if you have symptoms, then get a test.
The Oxford vaccine trial has been put on hold, we're told, due to a suspected adverse reaction. How much of a setback is that for you, Health Secretary?
Well, it is obviously a challenge to this particular vaccine. It's not actually the first time that it's happened to the Oxford vaccine, and it's a standard process within clinical trials. Whenever they find something that they need to investigate, and that's exactly what's happening right now.
Okay, but does it set us back in looking for a vaccine? I'm guessing it does.
Well, not necessarily. It depends on what they find when they do the investigation. As I say, there has been a pause earlier in the summer, and that was resolved without a problem. But what it does underline, I think, Kay, is that when it comes to the vaccine, we will absolutely do everything necessary to ensure a vaccine is safe as well as effective. And whenever we find a problem that needs to be investigated, then we go and then the scientists are going and doing that work. So we're always clear, whilst we're obviously enthusiastic about how important a vaccine will be, we're also clear that we will only introduce one when it's safe, and that we'll go through that proper process, because we want to get to a vaccine that is both safe and effective as quickly as possible.
Okay, we are out of time, but in the interest of fairness, I did ask you last week about Tony Abbott, and you responded in the way that you did. I said he's a homophobe and a misogynist, and you said, well, he's also an expert on trade. Did you want to add anything else to that today?
Well, what I'd say is that you can disagree with people on things, and I am nothing if not a supporter of everybody's right to live their life how they want to. And Mr. Abbott's sister, actually, who is herself homosexual, has come out and said that those accusations are wrong, and I think we should listen to her words very carefully. Thanks for giving me the chance to catch up on that subject.
Yeah, sure. And what about the former Australian Prime Minister, who herself said that he was a misogynist? Should we listen to her as well?
I don't know. I'm not that close to Australian politics. What I'd say is that I think listening to somebody's sister is always a wise thing to do.
So if you're not that close to Australian politics, how do you know he's going to be good at trade?
Oh, come on, Kay. I think that you could see that we know that he's had those responsibilities as Prime Minister of Australia, and I bow to nobody in my support for the values that I hold dear. That we should support everybody to get the most out of life, and that's at the core of my political beliefs. And as you know, I'm concentrating day and night on sorting out this unprecedented coronavirus crisis, including the news this morning. And it's your right to ask questions about other areas of government, but it's also perfectly reasonable to answer them and listen to the evidence that people's sisters give.
Of course, but you do come to talk to us today as collective responsibility as a member of the Cabinet. I know that you've got lots of other people to talk to, so we must let you get on. Health Secretary, thank you.
Nice to see you.
Thank you.